Hi, so I want to take a few minutes to talk about a topic that I referenced briefly in my last video, and that is the idea of difficult conditions and the labels that we put on those conditions, as well as the people who have those conditions. So, in my experience, there are many providers that don't like to work with people with certain conditions, and one of those is chronic conditions. So chronic is basically, just something that is lasting a long time. Traditionally, it's defined as something occurring for longer than 3 months. So the other conditions are those that are subclinical. So those are conditions where someone is experiencing the symptoms of a condition, but their lab values are normal. So, for example, if someone has subclinical hypothyroidism, they would be experiencing the symptoms of hypothyroidism, like fatigue, weight gain, cold sensitivity, depression, but their lab values, their hormone levels, would be within normal limits. So it's kind of difficult to diagnose and to treat because the normal standard tests that are used aren't showing that the person has a problem. The other is syndromes. So, syndromes are a collection of symptoms that follow a typical pattern, but the direct cause is maybe not clear. So, these would be things like metabolic syndromes, chronic fatigue syndrome, irritable bowel syndrome, um, fibromyalgia, and things along those lines. So they're a collection of symptoms without this super clear cause. Oftentimes, again, lab values might be within normal limits or kind of inconsistent. So there's nothing that points directly to a cause or very clear diagnosis. And then the last thing is multiple comorbidities. And this is really big because it's 50% of our population has a chronic condition, but of that, half of those people have more than one. So it's a greater risk for you if you have a chronic condition that you'll have another one. So it's very common to have multiple chronic conditions. And then as we age, that only gets more. So those that are over 60 years old, instead of it being that like 50%, it's now 85%. And those that have multiple chronic conditions over the age of 60, that's at the it's about 60%. So there's lots of people with chronic conditions, and then it kind of complicates it because they're difficult to work with, or at least that's what some providers think. The it does become that sort of shorthand, like I was saying, that the problem is the condition, not the person, but they get sort of equated over time. So, for example, kind of a common thing that might be said in a clinic is a receptionist is saying to the provider, hey, your 2 p.m. fibromyalgia is here. Instead of your 2 p.m. patient, it's your 2 p.m. fibromyalgia. So that person then gets completely reduced to their condition, which they probably already feel like that anyways. And now it's in the mind of the provider that all they are is this condition, which is very difficult to experience and very difficult to treat. They are completely reduced to it. So now there's this big mess of everyone feeling like their condition is just their entire life. So why is this difficult for providers? That's kind of something that is on the mind of people. It's why can't I just get help? Why isn't this person helping me? Why can't I get the help that I want, that I'm begging for at this point? And there are a few factors in my experience that I've seen with providers having a difficult time with these conditions. One is that it takes a lot of time to work with people on these conditions, and our current healthcare system doesn't really afford or encourage taking time with it. Our healthcare system is kind of overloaded. Providers have very high caseloads. Just think of, when you go to the doctor, you probably scheduled it and then you had to wait a really long time once you were already there. And your doctor has a very high caseload. So he's got 15 minutes to sit with you to talk about your 6 chronic conditions, and that's just not enough time. So not only is the person then very frustrated by this position, the provider is as well. So there's kind of this big cycle of hopelessness that the person doesn't feel like they're getting the help and attention they need. The provider also doesn't feel like they're giving the help and attention that the person needs, but can't do anything about it. So it takes a lot of time to work with people with these conditions, and the time just isn't really there in our current system. And there's also multiple contributing factors that that underlie these chronic conditions. So it's a lot to juggle in this high caseload system. And they often also don't follow a predictable pattern. So they're very complex in that there's like all these different levers, if you think of it like that, that are affecting this condition. And if a physician or a provider of some kind goes in and tweaks one of those levers, you may say, oh, like this is actually affecting my condition in a positive way. I feel better. But then something happens on another lever, whether you intended it to or not, that then affects the whole system again. And then all of a sudden, this great thing that seemed like it was working maybe isn't working anymore, because of all of the other factors that are influencing the condition. So it's very complex. It doesn't follow the standard pattern. And that's why a lot of providers may say that it doesn't feel good to work with these conditions. So it's very difficult to focus your attention on it. It's very draining. It leads to burnout and things like that, because the progress is very slow on them. It takes this sort of very slow process, and success is not linear in them. I don't know if you guys have seen like that meme where it's like what you think success will be like, and it's this nice like linear arrow versus what success is actually like, and it's this big sort of squiggly line that tangles all over itself and maybe eventually ends up in the right direction. But it looks like a big mess of spaghetti as the process is unfolding. So there's no quick fixes. There's no, here's your prescription and everything is fixed and everything is great. So the provider doesn't get to fix it. And that doesn't really feel good to some providers. So I would argue that last point, that working with people with chronic conditions when you have the time to do it is a really meaningful and rewarding process. That's why I went into it as my favorite population of people to work with. In my last clinic, I kind of became one of those people that they said, oh, well, this is a difficult case, like send it to her, So again, really difficult equals, difficult condition and needing a lot of extra sort of time and patience. And I do think that it takes a certain kind of provider and a certain kind of person to work with people with these conditions, to work with the conditions themselves, because it is a process and it is complex and it takes a lot of patience, and you have to be able to appreciate sort of a slow unfolding. And on a clinical level, I think these conditions are very fascinating to work with. And on a personal level, I get to take this big messy bowl of spaghetti that's just this giant mess and um, find the order with another human being. I get to work with them and kind of pull out all the strands and see this sort of slow unfolding that can be quite literally life changing. And that's really beautiful and meaningful to me. So that's my perspective on the issue. I'd love to know what you guys think about why is it so difficult to get help? Why don't providers maybe like to work on these kinds of issues? So let me know in the comments below, and also let me know what else you'd like to hear about, whether it's topics like this or whether it's more educational topics about certain conditions or about interventions. I would love to know what you guys would like to hear about. So let me know in the comments, and I will see you back next time.